Trigger warning, mentions of suicide during minute 1915 to 1945. If you need support, resources can be found in our show notes.
Welcome back to another episode of Jack Amplified. I am your host, Michael Braithwaite. I have the absolute pleasure of working with a great team at Jack.org as their CEO. Every 2 weeks, bi-weekly, we bring you another set of awesome guests or one guest. In this case, we have a single guest today, and you're not going to be you're not going to be dissatisfied with the fact that we have one very knowledgeable, powerful, and extremely fun guests dropping all sorts of knowledge on you today on this podcast. So what are we talking about today? What is our theme? Today our theme is Mental Health 101. We are understanding the data and driving change. Well, listen, I often say it doesn't matter what we know. It only matters what we can prove. The data does that. It proves and also gives us direction, right? Are we focused on the right things? Do we need to pivot? If people don't know, how do we get them to know? We can't do much without the data. And our guest today is all about the data. Even talking in before we started the podcast, he said, "Hey man, all I do is look at the numbers, right?" And he interprets those numbers too. We at Jack.org, we stress so much the importance of youth experience, in helping to shape those solutions, not just asking youth what they think and know, but also like the co-creation that we work on with youth involved at every step of the way. And that's really important. We want to link that co-creation, that lived experience up with the data together. We have some great info. We have a path to move forward. Today's guest is Michael Cooper. He's the Vice President of Data and Partnership at Mental Health Research Canada. I am sure you've heard of them. They're doing some of the most leading work in this field across the country in our wonderful nation. He has expertise in youth mental health and evidence-based interventions. He advocates for better detection, treatment, and support across the system. His work uses data to uncover service gaps that we talked about before. What do we need to do? Inform policy. What do we need to change? And drive meaningful change for young people nationwide. And I've been seeing it for the last 6 months. I've been involved. Report after report after report, dropped, shared, really shaping our sector. It's amazing. Michael, thank you so much for joining us today.
That is a fantastic introduction. Thank you for having me.
It's great to have you here. You and I have had some conversations about data. In fact, when I got into this sector, I said, "Who do I talk to?" And they pointed to you and your organization. Mental Health Research Canada has been doing incredible work um, to help us understand the reality of mental health in Canada through data. You help us understand the challenges and what we can do to improve it. So tell us a little bit more about the work that you're doing. What is uncovered about the challenges for around young people today?
So we started collecting data as a pandemic response in March, April 2020, when I'm sure we can all remember back at that time, we were feeling very scared and uncertain. And I was talking to my wife, who is fantastic. And she reminded me that every time there's a big challenge, there's a fantastic opportunity, or most of the time, there's a fantastic opportunity that comes from that. And I started looking into what we were doing to collect data on an ongoing basis. And what I found was a StatsCan survey that was happening every 10 years. There was a CAMH study that was happening for Ontario only, that was happening every 2 years. And most of these were taking multiple years to actually get to market. So we looked around and we talked to a number of organizations that weren't ready to pivot that quickly. And we talked to Health Canada, and they agreed that it was important to collect real-time mental health data. So we formed a partnership with Health Canada that is going at least until 2028. And we started collecting data in real time using an online survey, essentially, to ask Canadians, a blind study. They didn't know what they were getting about mental health. And we've evolved it over a period of times. We were asking a lot less clinical screeners. We've moved into a lot more clinical screeners since that time. And then after the pandemic, we pivoted to looking a lot at issues that cross section with mental health. So instead of just looking at mental health during the pandemic, we can now look at things like substance use and the intersections with
Mm.
mental health. Or we looked at problematic gambling. We just put out a report a couple of weeks ago on problematic gambling and the intersection. We're doing one right now on chronic pain and opioids, um, and and mental health. And then we're also looking at issues like literacy, stigma, how people support their mental health, and service access. So, I mean, it's one of those things that if I break my leg, I'm going to go to a doctor. So there's really good data that tells me how many doctor visits I have for physical health. But if I have a mental health issue, I can go to private therapy. I can go to the community. I can go to a public healthcare system. So we really needed something that would allow us to look at this on the aggregate, and that's what we've been trying to do since we started this project.
And so listeners understand too, and I did not understand this either when I first got in this field. Um, there was not a lot of data, like national data around mental
Yeah.
health. Um, I'd say even like if you go back 10, 15, 20 years, there was none, very little until MHRC started doing this work you're talking about. Am I correct?
That would be correct. I mean, we have pockets, like, we do have some public healthcare billing code data that tells us a little bit about what's happening in public healthcare, but there's been nothing that looked at it at the aggregate, in terms of group insurance or what people were doing or what people really wanted in their mental health. And we also realized very early on that we were collecting so much data because we wanted to put the kitchen sink of demographics into this thing. So uh, parents, age of their children, ethnicity, education, uh, postal codes, all sorts of data that we could aggregate. And it ended up creating this massive collection of data that we just couldn't all utilize. So we actually ended up giving it away free of charge to a lot of partners. So in addition to the 100 reports we've generated over the last 5 years, we have a host of equally as number of reports that have been done by partners who have partnered with us to put questions in or just taken the data and run analysis on it. So that really has helped put us at the center of a lot of this data. Is not only that we're producing so much reports in real time, but we're giving it away. We're very transparent about it because we're giving it away. And it has resulted in people being able to leverage this in different ways that we never even thought of.
Yeah, very cool. I mean, nothing I found too, and wherever you are in the sector, you don't do it alone. Partnership makes for progress. So last year, speaking of which, Jack.org worked with you on this report. MHRC released a Generation at Risk. It was a really incredible deep dive into youth mental health in Canada.
Yeah.
The report revealed the sheer scale of unmet need among young people. So tell me, what does the data point us towards? Where are the biggest gaps and how do we close them?
So it's important to understand that there are different gaps. So, we know that approximately 70% of the youth population isn't accessing a service, is fine with their mental health without accessing anything. Mental wellness that they can focus on, but we're not overly concerned about this population. And then there's approximately 19% of the youth population that's accessing a mental health support in any given year. And then there's approximately another over top of that, about another 9-10% of the population that indicates they should be accessing a support, but they are not. And the groups that concern us are the individuals who are not accessing support but feel they should be. But also among that group of people who are accessing support, about a third of them end up saying that the support is not meeting their needs. And what you end up seeing when you look at a lot of these mental health pathways is that people, if they have access to benefits, they'll typically access their benefits for the first attempt when they get a diagnosis or they need it, but those benefits run out. The average amount of group benefit insurance for mental health is $750 annually. And then what happens after that is they tend to look to go to the community because that's a more sustainable approach in that they're not going to have such a cap on top of the mental health support. And they also realize that they can't go back to public health care unless it's severely acute. A lot of them can't access public health care for that, and even if it was, you typically there would be wait list for a lot of that. That's where some of the longest wait lists exist. And again, it's quite expensive for a number of individuals. So what we do see is this shifting to the community. It may not always start at the community. People will say, "Well, I tried my family doctor. I went to 3 sessions for my group insurance, and then I finally found a community support that works for me." And then what's interesting to me is when their benefits roll over to the next year, a lot of them don't go back to those benefits. They stay with the groups because I mean, you're in mental health. You see this all the time. We've interviewed so many individuals who've got a diagnosis and a pathway to care. What it tends to be is some combination of medication plus treatments and supports that actually get there. And when they find that combination that works with them, they stick with it. They don't move back. So I think when we talk about gaps, I don't think we have a really good, robust strategy to support, especially nationally, community-based mental health care. There are some provincial level support. Some provinces do more than other provinces, but they tend to have one or two big partnerships, and then they neglect a huge array of smaller community-based mental health supports. And there really isn't a great funding mechanism on the national level for community-based supports. We have this new youth mental health fund, the
Mhm.
$500 million that the federal government invested, but we haven't had a lot before that for a long time.
And so these are some of the gaps, some of the challenges. What are you saying are some of the solutions? What does the data tell us? Like, this is where we go from here.
In terms of what, well, again, we don't typically get as granular in terms of what treatments are individual getting, so it's really hard for us to answer a question in terms of what's working. But from my perspective, given that a lot of people end up gravitating to community-based supports over a period of time, and that's what's sustainable for them, that's what we should be invested in. Because if those
Makes
fall
sense.
apart
Yeah.
or the funding falls out from underneath that, then they're going back to square one, which means they're not able to access a public healthcare support. They're not accessing a group-based support. I can say that in the work we have done looking at treatments, we're very big supporters of ICBT, and a lot of especially these hybrid options. One thing we've studied is the application of e-mental health, and we're very supportive of e-mental health. But what we have found is that when you layer mental health, which generally people are somewhat illiterate about. And when you're illiterate on something, you tend to have less trust for it because you don't understand it. It's a basic human behavioral science response. And then you layer in technology with which people may not understand. And so you've essentially layered two illiteracies and two distrustful things together. It ends up being that digital mental health is very hard for a lot of people to want to trust. Actually, we found that only 6% of people who accessed mental health support actually wanted something that was fully digital in their supports. But what they do want is they want hybrid solutions. So they want the ability to have a support and meet an individual who can help them, that can hold their hand, someone that they can connect with and trust. As you know, that mental health is really about connecting with individuals as well too, because it's very vulnerable. So what we have found is that we really do advocate, when we look at treatment options, as the hybrid solutions that we can leverage technology and people.
Very cool. Yeah, and when you talk community solutions, can you
Mhm.
talk a little bit, just drill down a little bit more on what are those? What are some of those community solutions for someone who may not, or is looking for some right now?
So a community type solution would be like a program that you might be able to access from service provider like Canadian Mental Health Association has 28 branches here in Ontario that deliver all sorts of services. There is a host of community supports, from like Kids Help Phone, where you can call in and it's not just referrals, you can also speak to a crisis counselor, these sorts of things as well. So these would be what I would be considering for community based services.
Very cool. Thank you for that. Now, in another report we want to talk about, it's called Generation Under Pressure. The report, so the economic and employment instability are showing a real impact on youth mental health.
Yeah.
We listen, man. If you read anything as day to day, you're talking about people that young people are finding it hard to get jobs, keep jobs,
Yeah.
and their mental health is paying the price. How are issues like the cost of living, job insecurity, and the future uncertainty shaping what young people are going through?
So this has been an issue we've been following since long before that report. That report is a nice exclamation point on a study that we've been doing for quite some time. When we saw the end of the pandemic, we saw a significant increase in mental health indicators, but then it started degrading again quickly as we went into this high inflationary period. And that was mostly concentrated among low income Canadians, but also young Canadians who were entering the workforce, who may not have those savings that they could rely on, or those investment accounts that were still going up during that high inflationary period, especially people who lived paycheck to paycheck. They may not have the investment accounts that were skyrocketing at the time if you're living day to day and prices are going up astronomically. And that's where we saw through 2023 and early 2024, most of this continued degradation in mental health was actually mostly driven with individuals who were struggling with cost of living. And then we were talking to Green Shield. They were launching a new ecosystem that was tailored towards youth, and they asked me what were the primary issues that were targeting youth, and among them was this idea of youth unemployment and high cost of living being a major driver of mental health. And what we do find in I'm young enough, hopefully, that I can remember the trouble of finding a job and how much stress that was. It's even harder now. And then when you layer in these complex needs that young people are facing, that they are struggling more with their mental health, and it's not just that they're feeling they're struggling more with their mental health. We're seeing this in symptomatic trackers, so symptom screeners as well. They're having anxiety about the future. It's a stress that is so deep and permeating that it can actually lead to actual mental health challenges, not just stress, which is more of a natural response, than it can actually drive into anxiety. There were the expectation that something could go wrong and the fear of that. The part that I was most interested in is the economic argument around this too, where there's lots of research, not ours, but others, that have looked at the long-term scarring effect of having um, high youth unemployment. That an individual who has remained unemployed for 6 months or longer has a lifetime earning drop over a period of time, and it's significantly attributed to what that does to their mental health.
100%, 100%. No doubt. And I just think, I mean, through the pandemic, we knew that it would take a number of years before you see those, the real effect too, right? And then, isolation piece. We know that the cost of living now has, I think, I remember the Canadian Observatory on Homelessness dropping some numbers, and they probably have gotten worse, that 50% of people living in the Greater Toronto area under the age of 30 were living at home, not because they want to, Michael, trust me,
Yeah.
but because they had to, right? And what does that do to your mental health when you're not able to kind of be independent and realize your dreams, those pieces? Also for employers who are hiring young people who don't have mental health literacy, don't really have an understanding of mental health, how to manage, how to manifest when they're looking at someone who they think might be underperforming in the workplace, but it might be just they need some mental health supports and they need to have a conversation around it, some of those challenges too. Thoughts?
Yeah, there's been some interesting studies that have come out that have actually demonstrated that young people want more mental health supports in the workplace, and there has been studies that have shown that young people are making the decision to go to certain employers because they have more mental health support. So there is a higher expectation of mental health support in the workplace by young people, and then I think though it's not just what the saying, well, we're going to put a support in there. We've
Yeah.
actually studied what supports are most helpful for individuals, and it tends to be around flexibility on time, and then the things that are least supportive for mental health are things like gym memberships or staff trivia. I personally love staff tips, but I'm maybe a generation away from this. But I find that it doesn't. So again, flexibility are some of the and flexibility with your job are some of the most important things people and employers can do to support mental health in the workplace. But and then so do the right things is what I would say as well too. So not just realizing it's important, but don't just pay homage to it. And we've also looked at where are people looking at inside their workplaces for mental health supports. And what we find is HR is the very bottom of the list
Yeah, yeah.
in terms of what people are looking at from their mental for mental health supports. It's almost always coworkers and direct management, and then way at the bottom of the list are executive leadership and HR leadership in terms of supporting mental health in the workplace.
HR comes with a sense of it's like a power imbalance, right? Like they're kind of
Yeah,
checking the balance, so you don't want what ifs if I tell HR, is
yeah,
there going to be some
and
kind of
trust. Yeah,
trust? Yeah, I mean, and again, we're not, listen, folks listening, we love HR. We can't function without them. However,
yeah.
it's just how you kind of structure these things, right? You don't want to have it so you have to go through your supervisor, someone who has some kind of power, and balance with you, right? Because what if, and then we see this with folks like, I remember, we lost someone by suicide in my hometown who was a police officer, and his parents talked about saying he was very reluctant to tell. This is again going back 15 years, but still, the fact that he thought he'd be regulated to a desk, right? As soon as he, chatted about mental health challenges, right? And so they're trying to change that conversation. So similar, we want to make this path as easy as possible, and you can do that by just listening to your folks, as you said, making the and really don't do it because it's going to hopefully not just because it might increase your bottom line, and it probably will if you do the right things. But your first your first concern should really be creating healthy workspaces for sure for young people. And I think if we do that, and productivity will follow.
So I think what's fascinating to me, we're functionally also talking about stigma here to a large extent, and I've studied a lot of different iterations of the ways we look at stigma, from what we would call prejudicial stigma, which is this idea of like, I really don't want to be around anyone who has a mental health issue. And we've studied that around 14 to 18% of the population that's actually actively stigmatizing. And then we look at institutional stigma, which is this idea of like, how have we built policies that prevent people from actually having positive mental health or being comfortable talking about their mental health? We've looked at issues around presenteeism and absenteeism. And what we find in some of those groups that, like, for example, police officers, and we also see it in some construction, we see it in mining
Yeah.
as well too, where the number of days people are missing due to their mental health is actually quite low. But the number of days they're impaired due to their mental health is quite high, which basically means that they're not able to take days off, or they're not able to spend time focusing on their mental health. So instead, they're just going to have a long-term significant impairment at work, and that's not healthy. So we often look at this as this gap between absenteeism, presenteeism, is actually, there's a healthy range here, where if both are really high, that's a problem. That means you've got one type of workplace. If you're having no days lost but a high degree of people impaired, that's also showing that there's something going on systemically within that sector that's actually, sorry, I'm getting into the weeds here a little bit, but it's showing that there's something wrong here. The other thing we've looked at stigma, which I find incredibly fascinating, is this idea behind, I'm comfortable talking about my mental health, but I'm comfortable listening to you about your mental health, but I'm not comfortable talking about my mental health. And so there's this delta, this gap between my comfort in listening to mental health, which I find is very high among young people. When I look at this issue, young people are among the highest in terms of saying, yeah, you can talk to me about your mental health. But the actual number of young people who are saying that they're comfortable talking about their own mental health is not significantly higher than other populations. So we still have a gap to address here in terms of addressing my comfort in talking about my mental health versus listening.
Yeah, that doesn't surprise me, Michael. If I just think of that like from a logic sense, when you're a younger person, not quite sure yet where you are, might be in the insecurities, or people going to make fun of me, what that trust and
Yeah.
exposure, right? Versus listening to others, the empathetic ear, right? So it doesn't surprise me. I know that from my own kids when they were in their teens, right? They were very good about listening to others, but very nervous about ever talking about themselves because it takes courage, right? It's exposing its vulnerability and showing
Yeah.
that vulnerability at an age where you're trying to figure out who you are, right? Now, listen, this is affecting mental health. Uh, affects young people all over the country, but even more so, we show big disparities for to us LGBTQ plus
Yeah.
youth, indigenous youth, racialized,
Yeah.
underemployed, unemployed, and newcomer youth, even
Yeah.
more so, right? What opportunities exist to bring these young people to the center of mental health work to change that?
I don't know if I can answer your question, but I'll try. So I certainly can identify with these groups within our data and demonstrate that there are significant gaps, especially with 2S LGBT2S plus. And we have seen newcomer youth. There's been a gap in terms of literacy, not literacy, but expectations around mental health for newcomers. Like, some of the newcomers we interviewed qualitatively indicated that they just don't have mental health wherever country they came from. They just didn't talk about mental health. So you have cultural differences for some of these, as well as this idea that I don't want to be a burden. And if I have a problem, I don't want to burden anyone else with that. That's the other thing we picked up a lot on when we were studying newcomers. So I've done a lot of work looking at these two particular groups. And the biggest gap that I can see is resources that were designed and available specifically for these groups. So if I'm 2S LGBT 2S plus, I am looking for a resource that would be specific to that need that I
100%.
may have. And It isn't just about saying, okay, well, someone's going to develop a resource or a worksheet that does it. It has to be authentic to that community. It has to be co-designed by that community, and ideally, it should be if they're working with someone with that organization, someone who identifies in that community. Because again, this is about establishing trust. And when you identify in a very strong way with one particular community or another, you're looking for advocates and supports that reflect that need.
Yeah. Yeah, well said. I mean, that whole like nothing for us without us applies
Yeah.
very much to this, right? Uh, let's talk about some of your job. I think has become even more difficult now with technology and AI and all these things going on because now everyone's an expert and has all
Yeah.
the data at their finger tips, right? So, what do you think are some of the most common misunderstandings people have about youth mental health in Canada?
Oh, that's a big question. And honestly, I would be more than happy if an AI wanted to come along and take my job. Part of what we do is try and take numbers and make numbers into stories. And I do feel that that is a really critical area that we have focused a lot on speaking at a level, an elementary school level, so that people can understand what's going on with mental health. And I'm very excited about things like AI because I really want to be able to tell our stories. When I go on the AI, most of the time I'm asking it questions. It's spitting back my research right back to me, which is always fascinating to see the way the AI piece. So I'm totally excited about that. I think if I'm thinking about what, sorry, your question was what specifically
What are the biggest misunderstandings, right?
misconceptions?
So,
Yeah,
yeah, I think so. In youth mental health across Canada. So, people have the
yeah,
data, but
yeah,
it's. I think you're talking a little bit about how it's interpreted and what the context around it is, right?
yeah, yeah,
So,
yeah.
and everyone now is diagnosing each other and
Yeah,
stuff
I
like
hear you.
that.
Okay, I got you. Um, I think that our literacy rates on mental health in this country are quite poor, to be honest with you. Some of the surveys we've run to actually evaluate whether people understand concepts and words in mental health, we're scoring back at like 25% accuracy, which is very, very bad. And so I think that we don't understand the difference between words like mental illness, mental health, and mental wellness. And, essentially, from my perspective, I've always considered health to be the large paradigm of all things like my physical health, I have mental health.
Yeah,
And then just like I could have a physical illness, I can have a mental health illness, or I can have a mental illness. I can also focus on being healthier. So I can have, I can have mental well-being. The idea that I'm actually going to focus on being better or healthier in my mental health. And I don't think people understand this. I think we have historically undervalued mental health. We have not put it on par with physical health. It's like this idea that your health stops at your chin, that we haven't focused what's on going on in the brain, and that how critical that is. I feel like I see a lot of finger pointing. I'm very regularly asked, like, "Oh, well, we see these high youth mental health indicators, and we wrote multiple reports on youth mental health." I get this all the time, which is it real or is it just kids just talking about it or giving themselves diagnoses? And I would agree there is a portion of the youth mental health diagnosis that is um, not true. I will contend and agree with this. When we interviewed individuals who had a diagnosis to check out about this, we did find there was a percentage of people who said they had a diagnosis. And when we actually pushed, it was my mom told me I had an anxiety, depression, or depressive disorder,
mhm,
or my guidance counselor told me. And so I've put my that label on myself, and that's how I identify. I do find that youth are looking for identifiable labels that they can help
mhm.
understand themselves. But I do not think that is the majority of this because we have unstigmatized words that we can look at. We have studies going back to the 70s that look at things like how would you rate your mental health? How would you rate how good you're feeling? And these indicators have gone down. They went down significantly in 2004 to 2006. They went down again as the pandemic was coming in. So these long-term indicators have shown us that youth mental health has got worse. So we can't dismiss it by saying, "Oh, well, they're all just making up these diagnoses." It's not true. There's a section of them that would be doing that, but it is definitely not representing the majority of the shift in the numbers we're seeing at this point.
It's funny. You said something there that if I'm going to be grammar police for a bit, not that you didn't say anything, but you remember when like when people would say, um, now people will say, "Oh, wow, that person has mental health." And to me, grammatically,
Yeah.
I'm like, "Well, we all have mental health."
Yeah.
Okay, it's like you wouldn't say that person has physical health. You'd end it with challenges or illness or whatever. But people now, the kind of term used to say, "Oh, yeah, he has mental health," meaning there's a
Yeah.
mental health challenge or illness or something attached to that.
Yeah.
But that's just kind of how the common language has gone, don't you think?
Yeah, like I agree with you. Like I wouldn't say you have physical health and you have mental health. Like to me, we have a conversation about, how is your mental health? It is something we all have. It is something that we typically take for granted, and we can look at it in the same paradigm that would you think about like, can I be healthier? Yes, I can be healthier. I could exercise more. I could spend more time, like equivalently for mental health. I could meditate. I could spend time trying to emotionally regulate and trying to these are all things you can do and you can strengthen your mental health too. We talk all the time about resiliency and the ability to actually bounce back from these things. Anxiety is typically the fear of the unknown happening, and we can try and address that. We can do things like our own ICBT, where we can try and train our brains internally to you know change the way we think about things. It's complicated, it's difficult. Most people would need some degree of support for it, but there's nothing wrong with trying to be healthier in your mental health space.
Just quickly for those who might know ICBT.
Oh, internet cognitive behavioral therapy. So it's basically retraining your brain to think about things in a different way.
Very cool. Thank you for that. We're going to go to a segment we like to call fact or fiction. I have to say it like that. Um, and so, fact or fiction, because young people are talking a lot more about mental health these days. If you talk about, you say, "Yeah, oh yeah, my friend has anxiety. And I know this in the last 10 years." However, does that translate? Do young people today have high mental health literacy? Thoughts?
That is false. They do not have high mental health literacy. We have studied this, as I mentioned earlier, from a consumption of media. And what we have found is young people are about 4 times more likely to consume content around mental health. But when we actually look at the underlying understanding that's coming from that, they're not scoring significantly higher despite consuming a lot more media. And I often describe this as a high sugar diet. You're getting a lot of really great caloric intake instantly, but it's not actually nourishing your ability to understand mental health. And so I'm really hoping we can elevate the conversation so that we can continue to improve literacy around the things we were just talking about, like uh, mental health, mental illness, mental wellness, these sorts of concepts, so that we're not just having it as a flash in the pan experience that people are having, but actually using it to understand and be healthier.
Yeah, I think, I don't know. I mean, I think many times we need, you mentioned it, and I thought it was great. We need that label because
Mhm.
if we don't know, we're not comfortable with the unknown, and we don't have something that kind of clearly defines it too, right? So there's the push for that, but we're also kind of, and I know this, I often talk about as a parent. If your children, say, "I'm struggling with this," we want to fix things, right? Mental health is not
Yeah,
necessarily something you fix, right? And it's not a one and done for the most part,
yeah.
right? There'll be different periods of life, but I think that's just kind of how many humans are built, right?
Yeah, I think most people don't understand that around mental health too, where like if I break my leg, I could get back
Yeah.
to having a functional leg that I can run around on and I can get back to regular use of that. But for most individuals who have mental health, it is an ongoing life issue that you will be struggling with for most of your life. You can do things to improve it, you can do things to treat it, you can become asymptomatic, but there's always a higher risk of you struggling with your mental health as a result of it. And I think people don't understand that as well too.
And much like physical health, you don't wait until you're presenting issues of physical health or mental health to actually take action. There should be
Yeah.
action all the time, right? We run, we exercise, we eat well because we're trying to prevent, our physical health. Similar, we should be working on always kind of preventing and maintaining our mental health as well, don't you think?
Yeah, could you imagine a world where we spent as much time focusing on our mental health as we do? Like instead of having like We'd have like a Ozempic for mental health, where we could take shortcuts to improve our mental health. And we do have some things for that, but for the general public, it's really about being mindful. It's really about trying to prioritize your mental health. We know that there are pieces of work coming out soon talking about the importance, and we have work coming out that actually says that when we look at mental health, most people aren't taking time to actually think about their mental health. It's just it's an issue we're deprioritizing in a busy world. If we had a world where people actually sufficiently prioritized mental health, we would be significantly healthier.
Oh, 100%, 100%. We would be, and yeah, it's interesting. I think. I mean, I always say that the world loves a good crisis, and so because we could respond and turn that around. And this is, I mean, speaks to the work that Jack.org does, in that preventing it from ever getting to that piece, we don't invest as much in. But if we did, what a different world it would be. So as we've come to the end of the podcast, and as we do with every guest, I want to end with a kind of a big picture question. And that, what are your hopes and dreams for the future of youth mental health in Canada?
Well, I hope that we can sustain this funding that we have for national organizations, because, as I said before, there doesn't seem to be a great mechanism, especially because every province prioritizes mental health in a different way. Some look at it more of a substance use challenge, which is a fraction of the people who need mental health support, while others are more focused on the mental health aspects of it. So I do think that as we achieve economies of scale, that would be great. I'm very hopeful of this movement we've been seeing about putting data at the center of mental health. When I started doing this 6.5, 7 years ago, whatever it was, I'm getting pretty old now. We didn't talk about data very much. It was this wild, wild west of the way we looked at mental health, and now we're actually validating things. We're actually looking at data to prove that things work, and we just don't have extra scale and resources that we can waste anything in mental health. So the fact that we're trying to validate what works, I'm really optimistic about that, and I feel like that's a movement that's gonna sustain itself. This idea that we're gonna put data at the middle of our decision making for mental health. Those are the things that sort of give me hope for the future, as well as the fact that we've taken that first step for a lot of young people. They're now much more comfortable hearing about mental health, and so we've started this journey. We know that, for example, when Bell Let's Talk started, conversations about mental health are up 1,300% when they run their January event. So we know that there's a lot more people talking about mental health. And if we could just capture that into actually getting people to move on mental health, we would be so much healthier from a mental health perspective.
Well said. Well said. You said something earlier too that stuck with me too. Is and I remember this just even from going around whatever sector you're in, that the data is important, but it's telling those stories around
Yeah.
it, right? You throw a bunch of numbers on a screen, people are like, "Well, I don't know, it's arbitrary. That sounds bad.
Yeah.
I
Yeah.
I don't know, like what." But when you put it, you make it human. You humanize it
Yes.
and tell
Yeah.
stories around. And this is Michael, and here's what happened to, sort of like, whoa, I could see myself in that, especially with youth. If you're talking to them, you just throw numbers on the screen.
Yeah.
How do I actually kind of wrap my head around that? And how do I kind of reflect to see myself in that data too, right? So the stories are important.
You're
As
absolutely right.
as we, sorry, go ahead.
You're absolutely right, and I think it's important that we have, like, we're number crunchers, and we inherently have struggled to try and tell that story. We've become much better at it over time, but we are at our core data analysts that want to actually figure out novel ways of solving problems by looking at data. But we also have great partners like Jack that have been really good at actually taking the information, the data that we're putting out there, and helping us tell stories by telling your stories to give things scale. Like, Michael is struggling with this way. There are a million other Michaels out there that are struggling in this way as well too. To give it scale, right?
All right, as we end the conversation, if there were some key takeaways, if people don't remember anything else but a few things, what would they be for you, Michael, from this conversation? What would you want our listeners to remember for the work that you're doing and some of the thoughts you shared today?
I want listeners to know that there are 1.25 million youth in this country that need mental health support every single year. And about 57% or three in five of them are not getting the support they need right now. So this is an area that we need to continue making sure governments and organizations continue to invest in. And I think we should be demanding good data, good evidence for all these sorts of pieces of work. We can't just accept, here's my program, it's great. We have to be demanding that we can actually see the evidence that these programs work. And I think we need to up the literacy of this country in a significant way as it pertains to mental health, because with literacy will come the ability to be better self advocates and address these challenges individually.
Knowledge is power. Absolutely. Michael, I want to thank you and your entire team for all you do for our sector, for our country, for our youth. It is so important and it's so appreciated. Thank you so much for joining us on the show today.
Thank you for having me. It's been a pleasure.